There's opportunities for firms in New Zealand to come forward and invest in technology, invest in the best practices they have within their country, in a country like India, which is still developing, and vice versa, things that have worked well in India, how that can be taken and translated in a country like New Zealand.
So we need the world-class technology to help us to be able to integrate all the care together, so that many software from the New Zealand help us to achieve that.
There's so much of demand in India for health IT that there's a rather sense of urgency around the path to maturity. And that path to maturity can be bridged by partnering with health IT firms in New Zealand.
First of all, as compared to back home in, say, New Zealand or Australia, is just growth. Okay, so you're looking at places, whether it's Thailand or India, where they're opening, a number of new hospitals on any given year.
Some of the opportunity in Malaysia for New Zealand IT-based companies are mainly in niche areas of health IT, such as the critical care, the business intelligence, and very specialized services. Because New Zealand IT companies, from my observation, are very innovative in those unique areas.
Without doubt, being in market, we've been here working hard in this area since 2005. We've really done our homework. We understand what our customers' needs are.
Although we want the high quality environment, we still aren't in a position to pay so much for the level of quality. We believe in having the same level of service as a much cost-effective manner. So if there are opportunities where a New Zealand company can invest in methods which can eliminate certain elements of bureaucracy, which translates into a benefit to the patients by paying less, I think that's where New Zealand companies can look at and help us in driving quality and efficiency.
I guess the thing that we've learned is that good things take time, and that you have to invest in getting to know the market, particularly in our space, which is quite a complicated space with lots of different providers, that building relationships up and building trust up are fundamental to success.
Initially, I thought the language problem would be a major issue, but we've overcome that by getting some of our staff to actually learn the language, employing some Thai staff. The number of Thai people actually trained in New Zealand. We've employed some of those people and have used them extensively in the Thai market, for example.
Our platform needed to adhere to the language of Mandarin, for instance. So the text messages going out to the patient's phone needed to be translated. So that was an important aspect. I think being really close to the customer and having a gauge for their requirements and being close and having that 24-hour turnaround has also been critical to our success.